The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Hey, thanks for joining us again. It is the Predictive Health Podcast, and today I am joined by somebody who I think sits in a strategic place in the alternative healthcare or the parallel healthcare system. Andy Schoonover, the CEO of CrowdHealth. Andy, thanks for joining us.
Thanks for having me. Appreciate it. Good chatting with you.
Let's just get into it. As you know, on every episode of Predictive Health, I ask the same 9 questions of our guests. The first question is, what one specific health issue are you going to address today?
Man, I know you probably want it physiological. What I'm going to talk about the health issue that is United States health insurance, which I think puts more people into physiological health issues and financial health issues than pretty much anything else in our country. So the health insurance space is something that I think needs to be burned down, and it will benefit a lot of people as a result of that.
I am in violent agreement with you. Okay, real quickly.
I hope the ATF doesn't call me. ATF, if you're out there, I'm using that.
Speaking metaphorically. So what got you interested in the health insurance side of this equation?
Sure. Yeah, it's my second healthcare company, actually. I sold my first one a while back. I swore that I was never going to do this again because it's such a brutal space to operate a business with just regulations and such. And God has plans of his own. I believe in his sovereignty. And so I am here again. I came off my other company and I didn't have health insurance. And so I went to the Affordable Care Act and got a plan. And it was $1,200 for me, my wife, and my 2 girls. And I joke it worked until I had to use it. My little one, who's 1 at the time, was having recurring ear infections. ENT said she needed to get tubes in her ears. Went and did that, followed all the rules, got it pre-approved, got the bill. It was $8,000 for a 15-minute procedure. I was just blown away by that. But then I got something in the mail a few weeks later that says it was medically unnecessary, so they weren't going to pay for it. So after a number of rounds of fighting with the health plan, I had to stroke an $8,000 check to the local hospital, and I was pissed. And so I quit health insurance and said, I'm not doing this anymore. And so I'm, now kind of over the last 4 years, figured out an alternative way to pay for my healthcare bills that, we can talk more about. But that was my kind of entree into, health insurance and my hatred for it.
I'm going to go a little bit off script because I think those who are not already familiar with your story will benefit from it. What is the biggest popular misconception about how health insurance actually works today?
Yeah, I call it a principal agent problem, where people think that the health insurance plans are out them getting really good rates. They are our agent. They're supposed to be out there working and fighting for us. But in reality, what they're doing is they're fighting against us. Health insurance plans actually have an incentive for prices to go up, not for prices to go down. So that's the biggest misconception. And just really quick, it's a quick math problem. I know I don't want to hurt anybody's head, but health insurance plans can only make 15% of premiums. So if you have $1,000 premium, they can only make $150. So how do they make 10% more? $165. Your premiums actually got to go up. That means healthcare costs have to go up for health insurance plans to make more money. There's massive perverse incentives that screw up this whole system. So in fact, the buyer of healthcare, health insurance plans, the seller of healthcare, hospital systems, both want the price to go up. Oh, I'm blowing up with stars. Even the Zoom thinks it's a good idea.
Zoom thinks it's a good idea.
Yeah. So the buyer and the seller of healthcare both want the price to go up. And so therefore, the price goes up.
Just to make sure we're clear, the people who are selling you the insurance don't really have any incentive for you to get the kind of treatment that allows you to not need them next year.
Exactly. That's the biggest misconception. Now, do they care about prices in the year? Yeah, they do. Right. So They want to make the max of that 15% as possible. So if it goes down to they're making 13%, then they got to push back on the hospitals a little bit. So they max out of their 15%. So in the short term, they want prices low, but in the long term, they want prices to go up. So it's just a total cluster the way that this, currently works. There's no free markets involved here.
In other words, there are no competing interests fighting to deliver the best services at the best price.
Exactly.
It's
net promoter score, which is like a way for companies to assess whether their customers like them. Chick-fil-A, I'm not a massive Chick-fil-A fan. I'm just giving you an example, is in the 70s, meaning like 70% of the people would say that it was an 8, a 9, or a 10 out of 10. From my understanding is oftentimes, or most insurance plans are in the teens, like 13, 14, 15, something like that. So health customers hate health insurance plans, because they all do the exact same thing. They are not out for the customer. They are out for internal profits. And that's just a bad incentive system.
Question 4 is always, what's the truth about this issue? And I think you just answered it. The truth is that the health insurance companies are not there for the patient.
No,
Period.
They're not.
That's not why they exist.
I'd like to tell you just a quick story.
Sure.
I sold into health plans in my previous job, funny enough. And so I was at a very large plan. I was with the chief medical officer of this large plan, and I was trying to show them a way that they could take better care of their patients with diabetes, who were having organ failure, who were losing limbs as a result of, really bad diabetes. I said, hey, here's a way that you can help these people and you can reduce costs. Literally said to me, F them. They don't lose limbs until they're in Medicare. This is a commercial plan. That was the response from the chief medical officer of a very well-known, very large health plan.
They don't care how sick you are. They're going to make their 15%. Is that
they're going to make their
about 15%? Right?
Look, I've met people with it that work at health insurance plans that are incredibly great human beings, right? Like a lot of people out there. So I don't want to say everybody who works at health insurance plans are awful human beings, because they're not. But the incentive system behind the C-suite of especially for-profit health plans, they are to make their 15%. That is our key goal. They are to maximize profit. And it is at the expense of you and me.
Question 5 is, what is the likely outcome if people don't take action? And we haven't actually talked about the action, but let's table that. What is the likely outcome for people who trust the medical insurance system as it exists? If they keep trusting it, what's the likely outcome?
Yeah, there's a couple things here that come to mind. One is, you have a 1 out of 5 chance, if you have an Affordable Care Act plan, that your plan is going to deny your claim. So you got a 1 out of 5 chance your claim is going to be approved or denied, which, if it's $100 bill, it's not that big of a deal. Mine was $8,000. Not a lot of Americans have $8,000 in liquidity that they can just, fork over to a hospital in the event that their, daughter has a perforated eardrum, which happens to lots of kids. Like, this is not, this is a recurring thing. Like, it happens all the time. It could end up in bankruptcy, and 200,000 families went bankrupt last year, even though they had health insurance due to a health event. 200,000 families. Okay. That can't go on forever. And so ultimately what's going to happen here is, people are going to put up such a fuss that I think what we're going to have, most likely, unless people really, grab on to an alternative, is we're going to have something that looks like a Canadian healthcare system, unfortunately, where it's government run, government operated. You're going to have to wait 6 months for a knee surgery if you need it. It's just a total absolute mess. Our system is expensive, but you'll be able to get service quickly. Canadians is less expensive. The outcomes are really poor, and you have to wait forever. What do you want? I want a United States system where it is inexpensive, it is really fast, and you get really good outcomes. And people looking at it, like, there's no way that you can do that. I'm telling you, with CrowdHealth, we have got 8,000 people who've signed up that have inexpensive healthcare. They get it really quick, and they go to the best doctors. So 8,000 is a small sample. It's a small sample.
Yeah, let's run this again. So in the United States, it's incredibly expensive, and there's very little guarantee. I shouldn't say little guarantee, but there's a pretty good chance that whatever it is, it's not going to be paid for. And in that case, there's a lot of people who are going to go bankrupt, although the care might be pretty good. Or we could go the Canadian route, which is cheaper and worse care. And then there's your solution. So let's talk about CrowdHealth. What makes it different? How's it work?
Yeah. One quick point on that previous one. I think people might hear this and be like, oh, the United States has terrible outcomes. That is actually not true. The problem with the data that those people look at is they forget to adjust for obesity. And so given that the United States has about 50% higher obesity rates than, many of the comparison countries that they're looking at, those people are going to have worse outcomes. That has nothing to do with the doctors. It has everything to do with the lifestyle. And just give you one quick example. If you get a knee replacement and you're 500 pounds, guess what? The probability of that knee replacement working versus being 180 pounds is vastly lower, right? Like you're going to have another one. So you're going to have a bad outcome as a result of that, right? Just wanted to quickly, just mention that real quick.
That's a real good
doctors in the United
clarifier.
States, if you have a bad problem, are the best in the world, the best. And, we can talk about kind of the caveats of that. But if you have cancer, you want to be in the United States. If you have a disease that is rare, you want to be in the United States. So just wanted to make sure I don't throw on doctors because we got great doctors in this country.
Agreed. Good stuff. All right. Let's talk about CrowdHealth. What's your solution to this problem and how's it work?
Yeah, we pay everything in our lives in cash, at the point of care for the most part. Like we go and, get our car done and it's, we pay in cash. And in fact, we go and do our eyes or our dental or, we get LASIK surgery. We get cosmetic surgery. All those things are paid in cash. And guess what? They're not that expensive. If you pay in cash, you are getting something that is of high value at a really good price. And so what we're trying to do is enable people to pay all of their healthcare bills in cash. And as a result of that, hospitals, doctors are willing to give our members significantly lower prices than if they have to go through the bureaucratic system of billing health insurance plans, maybe getting it approved, maybe not getting it approved, waiting for 3 or 4 months to get paid. If you could rip all of that out, what we're seeing is that the system is willing to take about 50% or 50 cents on the dollar versus what health insurance plans pay just by paying cash at the point of care. I'll give you, an example. We had a woman in Austin. She tore her ACL playing pickleball. She went to the orthopedic surgeon, said it was going to be, I think it was $22,000 or $24,000. We called the orthopedic surgeon. We said, hey, listen, if this member can pay cash at the point of care, what would you do? And he said, I would take a significant reduction. And he said, you know what? Why don't we move it from the hospital to the surgery center? And if we can do that all in, we'll do it for $11,000. So it went from $24,000 to $11,000 just by engaging the doctor in a, patient-doctor relationship. And, you dropped it by more than 50%. If that person was on a health insurance plan, they would have paid more than $24,000 for that same exact procedure.
Somebody would.
Just one example.
Yeah. All right.
And by the way, that doctor is the one that is the doctor for the University of Texas football team.
Oh,
this
so
is
he knows
the
what he's
doctor. This is the doctor you want working on your, MSK, knees, elbows, shoulders, things like that. So this is not your cheap doctor. Yeah, sure. I'll take anybody who wants to come in. This is like a wickedly good doc.
How does this differ from standard health insurance, from the health insurance model that we're all familiar with?
Yeah. I'll walk through the mechanics, but I'm going to give you the conclusion first, which I think is just super cool. In essence, what we're doing is we're going to a community of people and we're saying, hey, Andy has a problem. Will you help him? Let's say I broke my arm and it's $5,000. Andy's going to pay the first $500. We're going to submit the remaining $4,500 to the community. So we're going to ask 45 people for $100. We're going to send them a note and say, Andy needs help. Will you send $100 to Andy? Yes or no? If they say yes, $100 goes from their account to Andy's account. If they say no, we just move on to the next person. And then after 45 people say yes, Andy now has the $500 he put into his account, and then the $4,500 the community put in the account I have $5,000. So when I show up at the doctor, I can pay him, directly $5,000. And as a result of that, he's like, wow, this is amazing. I get cash now. I get it with a credit card. A doctor on average has about 3 billing people per doctor
Yeah.
and spends about 25% of their time fighting with health insurance companies around pre-authorizations and getting paid and all these kind of stuff. So if they can rip all that out of the system, then they love it. They're like, please, let's do this. Send me more people. Send me more people. So in essence, what I'm doing is I'm just enabling people to pay it cash at the point of care. And we've done this now 10,000 times over the last 2.5 years, $7 million of bills. And I think we're like, of the $7 million of bills that got submitted to the community for funding, 6,000 went unfunded, and the remaining 6,994,000 or whatever was funded. So why was that 6,000 not funded? Remember, and I told you that we sent the bill to people, they could say yes or no. If they say no, people know that when they ask for something. So let's just say that Andy had asked, had said no the last 10 times that I was asked, and I submit a bill to the community. Community's like, look, dude, you said no to everybody else. Like, why would I give you money? So I'm a taker and not a giver. And so the takers typically aren't getting their bills paid. The givers, 100% of the time, if you're a giver, that bill has gotten funded by the community, and it takes about a week to get that done. So it's pretty quick.
So what do you do with your current health insurance policy that we're constantly bombarded with? I think there's a common belief that you have to have health insurance. What do you do?
Yeah. If you were to give me two lies that in your previous question, like two lies that people believe, the second one would be you have to have health insurance. I truly believe that health insurance is riskier than what we do. They are battling against you. We're an ally for you. We're on your team. What happens if you have something big, health event? What is the first thing people say? Oh, now I got to go fight my health insurance plan. With us, they're like, oh man, I get to call CrowdHealth and they're going to help me. They're going to be my ally. And so we're really trying to just be people's allies on this journey. And it's actually, 3 years ago when I started the company, I had a vision for how this would look, and it's actually worked out better. It's worked. The bills are lower than what I thought they were going to be. We were able to get bigger discounts than what we thought, and so every kind of forecast that we had in terms of healthcare bills, we're actually doing better because there is a yearning in the healthcare community to get away from health insurance and have a cash pay direct relationship with the patient. If you're not paying for the product or the service, guess what? You are the product. And so you're not paying for your healthcare bill. And so guess who the doctor has to appease? Not you, the person who needs healthcare. They have to appease the health insurance company. And that to me is BS. If I'm paying the doctor, I can tell you from being a patient on a cash pay, it changes the game. The doctor, I had to get some imaging done. And the doctor, look, if you're with health insurance, I'd have you come back and we talk about the results. But can I just call you on the phone? And I'm like, hell yeah, you can just call me on the phone. Are you going to charge me for that? No, I'm just going to call you and we're just going to go over it. But if you were with health insurance, I'd have you come in. And I'm like, what? This is crazy. First, the last thing I need to do is spend 2 hours of my day sitting in a doctor's office. Like, it's the worst thing ever. And that relationship, I mean, it's crazy what people do when you say I'm a cash pay. They like light up. They're like, what? It's between me and you. Let's do it. Let's go.
Suddenly it's a different relationship. What's the biggest compliment, or at least most common big compliment you get?
It's great because we've got, I think, 250 reviews now on Trustpilot. So if anybody wants to go and see it, it's pretty cool. And I was talking to an investor the other day, and he was walking through all these reviews. And he's invested in probably, 500 to 1,000 direct-to-consumer companies. And I have never seen reviews this good for any direct-to-consumer company. And you're in healthcare. Like, I can't believe it. It's like healthcare companies are always the lowest in terms of customer reviews. And these people are putting like paragraphs and paragraphs of like why CrowdHealth is amazing. We had one woman, it's going to bring me to tears. She lost her baby with CrowdHealth. I mean, it just was one of those things. It's just one of those crazy things that happens, and she lost her baby. And we just loved her, that woman, like loved that family, and she's like, I can't believe this healthcare company loved me so well. I'm like, man, that's the best compliment you can ever have. I'm told I've been brought up to love your neighbor, right? Let's actually I tell my team this all the time. Whether you're Christian or Jewish or Muslim, we have all of them on our team. Like, we got to love our neighbor. Like, you got to love our people really well. And it's like, we have a big heart. That's our logo. It's because we want to love our people really well. And I think if you go to those Trustpilot reviews, you'll see more times than not, we love our people really, not perfect, but we try really hard to love our members well.
All right, let's go to the other side. Most common or biggest complaint?
It takes one extra step. Most people want to go in and they want to have a card and they flap down a card and they don't want to deal with it anymore, right? They don't think they're going to deal with it anymore, but when the explanation of benefits comes in, they have to deal with it. And so what we're saying is, look, will you just call us beforehand so we can help you find a really great doc who will take, cash? Because if you do that, then we can crowdfund this beforehand. You can have the cash and then you're done. You're done with the payment at the point of care, as opposed to having to worry about it later. So it's one more step that you have to call us. You don't have to, but we just say, please call us. And people say, I prefer not to have that one step. I'm like, it's just something that we have to do to, get you really good, service, really good price, really good doc. That's the one complaint. I get it. These explanation of benefits that you get, I don't know if you've gotten one, but I went to Stanford. The number 2 guy in our class was my roommate. And he said, there's nothing in this world that makes me more confused than an explanation of benefits. This is the number 2 student in the MBA school at Stanford, right? This guy is wicked Yale, wicked smart. And he's, I just don't get it. I can't even make the math work. This is addition and subtraction, and it doesn't even still work. You're like, what the hell's going on here? It's like, you deal with it up front or you deal with it at the end. Which one would you prefer to do? We ask our people to deal with it up front so you don't have to deal with it in the end. And that saves just massive amounts of money. We think we've saved our members about $10 million over the last 12 months in healthcare costs.
All right. So let's get to the one that I love the most. If you could deliver just one message about health and you only had 8 words to deliver it in, what would those 8 words be?
8 words. 8 words. Yeah, I would say I'm only going to take 3. Ditch health insurance.
Oh, I love it. Ditch health insurance.
Exit the system. Oh, maybe that's 6. Ditch health insurance. Exit the system.
Depends on which market we're talking to, I guess.
Yeah.
All right. Andy Schoonover, CEO of CrowdHealth. I know that we will have provoked an awful lot of questions, which I'm sure you've answered in other places, and probably many of which are answered online. Where should folks go to get more, to get their questions answered specifically about CrowdHealth?
Yeah, I think that the most fun place is on X. We have lots of fun commentary over there. Our today was a fun one. We crowdfunded a testicular torsion. And so we asked 9 men and 2 women. That was just kind of random. And, it was a plea to the 2 women. We know you don't know how this feels, but trust us, this is not good. Like, help this man out. We have some fun commentary over there just about the healthcare space in general and, specific examples like that. So X is the best place, and it's at Join CrowdHealth. JoinCrowdHealth.com is our website. So you can check us out over there as well.
All right. We'll make sure that information is in the show notes. Andy Schoonover, thanks for joining us on Predictive Health, and we will see you all next time.
Thanks.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.